to In a Heartbeat, coming to you today from Henry Ford Hospital Medical Center, Pearson Clinic here in Grosse Pointe Farms. I am so honored to have today as our guest Dr. Henry Lim, who's chairman of the Department of Dermatology at Henry Ford Hospital. Dr. Lim has been a guest in the past, and I'm so honored to have him here again today. Dr. Lim, welcome to In a Heartbeat.
David, thank you very much for having me again.
It's our pleasure and an honor to have you.
Thank you very much.
Dr. Lim, I know you as a colleague,
Yes.
and I know many of the roles that you play and the many hats that you wear. But I'd like you to tell our audience about some of the roles you play not only here locally in the Metro Detroit area in Michigan, but also nationally. We have a world-renowned national figure here right in our backyard. And so could you please speak to that for us, please?
David, as you know, I arrived here from New York City. I was at NYU prior to coming here, and I was a full professor of dermatology at NYU. Came here in 1997, so it has been a quick 18 years. It has been a very, very gratifying and fun-filled 18 years in dermatology, leading the dermatology department at Henry Ford Hospital. I'm currently the chair of Henry Ford Dermatology Department, as well as the Clarence Livingood Chair of Dermatology at Henry Ford. In addition to that, I've been fortunate enough to be able to lead the organizations in multiple ways. I was the president of the American Board of Dermatology, and that is the organization that gives certification to all the dermatologists in the country.
And before you continue, I just want to say that is one of the most prestigious boards to be on, and to be the president of that, I think, is quite an accolade to you.
Thank you very much.
I don't want to interrupt you. Continue.
No, thank you very much. Clarence Livingood, the founding chair of our department, was very much involved with that board, as was my immediate predecessor, which is Dr. Edward Kroll. In addition to that, this past spring, I was just elected as the incoming president-elect of the American Academy of Dermatology. And this is the largest dermatological organization in the world. Approximately 95% of U.S. dermatologists belong to this particular organization. It is an important one. It is truly an honor for me to be elected. I'll become the president in March of 2017. So
that is quite an honor, and that is a popular vote done by, so each dermatologist gets a vote, and Dr. Lim here was the clear winner.
Thank you very much. It truly is an honor.
It is. And so, so you have this wonderful background, and today you have some special areas of interest in something that we're going to focus on, and that's sunscreen and sun protection. There are many ways that people can get sun damage, and maybe you could speak to some of those, Dr. Lim.
Sure. The sun exposure is something that we all would be exposed to. Going out, you will be exposed to the sun. And as a dermatologist, I always tell my patient it is totally positively important to go outside to be able to enjoy life. However, in so doing, one needs to use sensible, what we call photo protection, because it is protecting yourself from the side effect of the sun. And that would include staying in the shade while outdoor, wearing appropriate clothing on the exposed area, putting on sunscreen, wearing sunglasses, wearing white brim hat, especially for men. A lot of time, men, just like myself, we're starting to get bald on the top, and then we need to wear a hat to cover that area, because otherwise that area would get sunburned. So one should be able to go outside, enjoy life, but at the same time protect our skin by practicing common sense photo protection.
Dr. Lim, I thought it might be fun to role play a little bit. And, you know, pretend I'm a patient of yours, and I come in and I have a fairly dark tan.
Yes.
And I'm just going to go over some things that we probably commonly both hear, and I'll be interested in hearing your answer to that. So I would say, Dr. Lim, although I have a tan, I don't really lie outside in the sun. I don't sunbathe, but I'm just an active person, and I'm outside a lot. I have kids, or I garden, or I golf, or I walk. That's okay, isn't it?
Well, in a way, it is okay to do all those activities. However, it comes back to the point that I made before. If one goes outside, one should practice sun protection. And tanning actually is a response on the skin to try to protect itself against the side effect of the sun. So when we do get tan, that means that there have been, one, exposure to the sunlight. Number two, the skin is trying to protect itself from further damage. Therefore, there is a tanning response. So one way to do it is that before going out, make sure you put on clothing, apply sunscreen, and so on. That way you can continue to go outside and at the same time to prevent the skin from being damaged. And that goes along with a lot of patients ask me, well, before I go down south for a winter vacation, Caribbean, and so on, should I go to the tanning booth to get a base tan before going down? That is truly not advisable, because any type of tan is an indication of damage to the skin, and the tanning booth, the tan that is caused by the tanning booth, just like the tan that is caused by regular sun exposure, is truly not very protective against further sun damage on the skin. It is, however, the skin's attempt to try to prevent further damage, but it is not a very effective one as compared to wearing clothing, putting on sunscreen.
So Dr. Lim,
Yeah.
as my doctor, I would say, but Dr. Lim, I like to get color, and I like to be tan because it's healthy for me and I'm getting my vitamin D. That's okay, isn't it?
Well, it's a very, very good question, because vitamin D clearly is very much in the press nowadays. It is important vitamin. We do know that vitamin D is important for bone health. We do know that we need vitamin D to make sure that we have minimizing the risk of bone breakage, fracture of the bone. However, there are many other ways of safely obtaining vitamin D so that we can get adequate level. That would include diet. However, the easiest way probably to take is to take vitamin D supplement. Vitamin D pills, very inexpensive. Our recommendation usually is between 600 to 1,000 international units per day. And most of the multivitamins nowadays contain that particular amount. So if you take one multivitamin a day, that usually is sufficient to get the adequate vitamin D level. Obviously, when we drink milk, even orange juice nowadays, many of them is fortified with vitamin D. Milk is for sure. A lot of the orange juices and all the fruit juices are fortified also. So it would be an additional source of vitamin D. Freshwater fish is another very good source of vitamin D.
Well, I'll get to one of my other excuses.
Sure.
Dr. Lim, I just feel better when I have color and I'm out in the sun. Sure. And I don't really feel good. And I don't feel myself if I'm not tanned or I'm not sitting out in the sun. And you would say?
There are two aspects in that. There's definitely a very good physiological explanation why one feels better when one gets sun exposure. It has been shown very clearly now, primarily through study in tanning booths, that if one gets exposure to sunlight or to light in general, it would result in a production of a molecule in the body that would make us feel very, very well. This is very similar to when one runs, doing marathon, doing just jogging in the morning. They would elevate this particular molecules level, endorphin, and that would result in one feeling good. So there is a good physiological explanation for one is feeling good. However, this is also, in a way, the reason that patients go to indoor tanning all the time, because they develop essentially an addiction because of that. In many sense, it is an addiction because they get elevated endorphin and they feel good. That's the reason they want to continue to go back. However, we do know that it is by getting tan, the skin is damaged. So definitely, one needs to prevent that. And you can still go outside, you can still go run. Photo protection, sun protection is important.
Dr. Lim, while you were speaking about tanning booths, probably one of the demographics that most often uses them is a female who's in their teens or 20s or 30s. And what is the relationship that you have found through tanning booths and the incidence of skin cancer and melanoma?
It is very well established. The data is very clear now that the use of tanning booth is indeed associated with increased risk of skin cancer, including the most deadly form, which is the melanoma. There are two aspects here. One is that the demographic, as you had mentioned, indeed, you're absolutely correct, that usually is the young teenage, most commonly girls, most commonly fair-skinned individuals who cannot tan very well to start with. So when they go to the tanning booth, actually they don't get very much tanning. They may get slight redness, but a little bit of tanning, but because of the way that their skin color is, a lot of time they don't tan very well. But nonetheless, this is the demographic that would go. Most commonly, obviously, at the end of the school year, before parties, before summer, and so on and so forth. It is not definitely, this is when the study about addiction has been done, that this group of patients unfortunately would continue to be exposed to tanning booths because they feel good, under social pressure also they want to go. We do know also, however, nowadays that tanning exposure is very much associated with skin cancers. In fact, about 2 years ago, we have a hearing, an FDA hearing in Washington, asking various organizations, including patient support groups, to explain to them what the side effects of tanning exposure is. A lot of patient organizations went there. I was the organizer for that particular meeting on the response to the FDA request, and it was quite moving and quite shocking to see. A lot of patient organizations, they talked about their own personal experience or the experience of their loved one who had passed away because of exposure of tanning booth, because of development of skin cancer. So it is truly a very strong association. That is the reason now, more than 40 states had some restriction about access to tanning booth, either outright ban, or many of them is that if you are less than 18 or less than 17-year-old, whatever the definition of minor is in the state, you need you need the consent of your parents before you can access a tanning booth.
And so tanning booths are really definitely not a safe way to get a tan.
It is not a safe way to get a tan, absolutely not.
Going down a little bit of a different avenue, so Dr. Lim, I'm going to Florida this winter, and I want to have the right sunglasses. These sunglasses over here cost $10, and these cost $100.
Yes.
Is the $100 sunglasses better than the $10 pair?
My advice always is that look for sunglasses that you're most comfortable in terms of wearing, in terms of the style that you like. But the important part is to look for the sign of UV protection. Most of the sunglasses now have a label to say they are UV protective. Those are the good sunglasses to have. There's very good standards within the industry in terms of sunglasses as to what type of UV protection sunglasses should have before the label is put on. Unfortunately, while that part of regulation is mandatory in many parts of the world, it is not mandatory in the US, but many sunglass manufacturers would put that on. So just make sure that it is a UV protective sunglasses. The other part that is important is that for sunglasses, it is better to have a larger pair, if possible a wrap around, because a very, very small sunglass would be actually make more damage to the eye potentially than a larger pair of sunglasses. When you have a very small sunglasses, there are a lot of reflection from the sunlight, from the skin going back to the eyes, and it is just the eyes becoming more exposed to it.
So get those big Jackie O sunglasses that really cover
as long
the
as
eyes.
it still looks stylish.
That's always important. Dr. Lims, you were part of an FDA task force on redefining what sun protection is and
Correct.
SPF factors
Yes.
and sunscreens.
Yes.
Tell us about what results came about and the process and what is recommended today and
Sure.
how that's changed.
That task force was an important one that has gone on for quite a few years, and the final ruling by the FDA was released at the end of 2011. But essentially up to that point, what we have in the market for the consumer is that they have an SPF value for all the sunscreen products. SPF, the sun protection factor. I think most of us, most of our patients, most of the consumer understand that sun protection value, sun protection factor, the higher the number, the better it is. 15, 30, 45, 50, and so on and so forth. However, up to that point, what the consumer in the U.S. did not have access to is that the UVA protection of the sunscreen. Let me step back a little bit. In the sunlight, in terms of ultraviolet light, there are two spectrums that is very, very important for our skin. One is called UVB. The other one is called UVA. Excuse me. UVB is the burning spectrum. There's an easy way to remember it. The B is the burning spectrum. So if you go outside, get sunburned, it is predominantly the effect of UVB. On the other hand, UVA, the easy way to remember it, the A is for the aging spectrum. That is the one that would cause wrinkling. That is the
we
one
don't want A or B.
That's correct. That is the one that would cause tanning. That's correct. So up to that point.
And the A is in the tanning booths.
The A is in the tanning booth. That's correct, yes. So up to that point, the SPF value is predominantly a reflection of the protection of sunscreen against ultraviolet B, the burning ray. They do not reflect the protection against ultraviolet A, and now we know ultraviolet A is very, very important. Also, it would cause tanning, it would cause wrinkling, it contributes to development of skin cancer. For many, many years, all parts of the world, all the sunscreen, they have various indicators, various tests that would allow the consumer to know whether the sunscreen would protect also against UVA. So that was the effort that we did in working with the FDA, which eventually lead to the release of what's so-called critical wavelength, which is the method that the FDA had chosen to say that the sunscreen is protective against UVA. So the part that we need to look for right now is relatively straightforward and simple. You look for the SPF, so you'd like to use, usually we recommend to use SPF at least 30. If you're going to be outdoors for a long time, the higher the better, up to 50 probably. And then you look for broad spectrum. There is a label on the sunscreen that would say broad spectrum. Now the sunscreen labeling of broad spectrum can only be done if the sunscreen had passed that test that FDA had required all sunscreen manufacturers to do. So if they pass that particular test, so-called the critical wavelength test, the detail is not that important, but it is a test that is done in the laboratory setting. If they pass that test, that means that the sunscreen product would have enough UVA protection, then they can put down the broad spectrum. So my advice to all my patients, to consumer in general, is to look for sunscreen with a good number of SPF, 30 or above, and also to look for broad spectrum labeling on the sunscreen.
Dr. Lim, is it true that an SPF factor lower than 30 is considered to be not protective against skin cancer?
Well, it is partially true. The best study on this particular aspect, that is whether sunscreen would protect against skin cancer, actually was done with SPF 15 sunscreen. And that study was done in Australia. It was a very good and very long-term study. It is a very superbly done study. It was a total of 12-year follow-up. That's the reason they started with SPF 15, because at that time when the study was started, that was the best sunscreen in the market. So at least using SPF 15, they were able to show that there is a decrease in the development of skin cancer in those individuals who were asked to use sunscreen during that period of time. So even with SPF 15, it is sufficient in that study, which is done in sunny part of Australia, that it is sufficient to prevent or to decrease the development of skin cancer. So our recommendation is at least 15, but generally we use 30. The reason we recommend a higher SPF is that because we know when individuals use sunscreen, they use it at the amounts that is less than what FDA required for testing. FDA required testing of sunscreen at the level where so-called 2 milligrams per centimeter square. Translated, when one covers the entire body surface using that particular concentration that is required by the FDA for testing, it would require 1 ounce. We know that we all do not use at that level of sunscreen. So most of us, it has been very well documented in multiple studies when we use sunscreen, we use probably at the level only 50% what the FDA mandate the testing to be done at. And because of that, that's the reason we recommend a high SPF sunscreen to compensate for the fact that when we use a sunscreen, when the average individual, including probably ourselves, when we use sunscreen, we may not be using it at the concentration that the FDA is testing it for. And because of that, the label SPF is going to be higher than the actual SPF when you use it on the skin.
So Dr. Lim, when your patient says, Dr. Lim, I'm doing great with my sunscreen, I'm still using that sample you gave me a year and a half ago, and I'm doing fine. They're not using the right amount.
Correct, yes. And the other part that I want to point out is that the sunscreen, they do have expiration date. Many sunscreen do now that they put it down on the label. Not all, but many of them do. And usually my recommendation is that after one season, probably it's best to get a new sunscreen because no matter how good the sunscreen is, when you put it in the glove compartment, you get exposed to a lot of sun, a lot of heat. Some of the compound would degrade within the bottle, so it's better to get a fresh bottle.
Dr. Lim, what is on the horizon for new skin cancer treatments?
Well, there's several. In terms of the photo protection, I'm going to start with that first. In terms of the sun protection, there's development in the industry now to see if one can get antioxidant in the sunscreen that would be biologically active, meaning you apply the sunscreen that contains antioxidant. So the sunscreen would do its job, meaning to protect from penetration of the ultraviolet light, but the antioxidant in the sunscreen would go into the skin to prevent damage caused by any type of sunlight that would have penetrated into the skin. So it's a dual effect. Technology is not quite there yet to be able to have these antioxidants to function very, very well when it's applied on the skin, but I think it's getting there, so it's getting better. My expectation within a few years, probably there will be sunscreen with very good not only SPF, meaning the protection, but also has active antioxidants. There are many sunscreens right now that contain antioxidant, but many of them actually are not very effective in terms of the antioxidant component of the sunscreen. That's number one. The other part is the sunscreen pills. That is another development that is, again, not quite ready yet for prime time for the interview here, but nonetheless, it is a development that is ongoing. This is taking the pills internally, and then some of these pills are able to suppress the development of sunburn reaction. Many of these pills, they contain antioxidant that would work on the level of the skin. So that is another development.
I could see where the consumer might have an interest in that.
Absolutely.
Probably rather take a pill than apply sunscreen.
Right. At this moment, my recommendation usually is that if you want, because those pills are available over the counter, my recommendation, if you want to take the pill, that's fine, but I would not replace it yet for the rest of the photo protection or sun protection measure that we talked before, because the data is not strong enough for me to be able to say, look at you in the eye saying that yes, just take the pill, forget about the rest, because I don't think we are quite there yet. But again, there is a new development that is moving. Obviously, on the laboratory setting, there are a lot of exciting development of using different type of molecules to target the various pathways that would result in the development of skin cancer. It is a very sophisticated laboratory type of setting. Some of the medications are available. Clearly, those are more for late stages of the skin cancer, including melanoma, and still in many cases still in the experimental stage. Some of the medication has been released into the market though.
Dr. Lim, we are in the Pearson Clinic here at Henry Ford Hospital, Grosse Pointe Farms, and this is exciting also as well, and a good time to speak with you and interview you because you're going to be seeing patients here.
That's right.
And,
yes.
And that's really exciting. And tell me about that.
Yes, we are reopening this clinic. We used to have the clinic here many years ago. In fact, I used to work here.
I remember that.
That's right. Being an East Sider, I used to work here. And nowadays, I'm looking forward, actually. The clinic is going to start in September. And there are 3 of us who will be coming here on a rotating basis, one being the predominant site for this particular doctor here. Then the other 2, myself included, will come out here on a rotating basis. I'm looking forward to this. It should be an exciting place to practice.
That's great, because
yes.
I'm sure you have many patients, I know you have many patients around here,
yes.
and so they probably love that easy accessibility
sure.
here.
Yeah.
So tell me, what sort of services in dermatology will you be offering here?
Well, we will offer general dermatology care for all patients. So in any type of skin rashes or any type of dermatology condition, skin cancer, skin check, and all those, we will do it here. Clearly, our main academic site is at the New Center 1 downtown area, where we have a lot of what we call subspecialty clinic. So these are clinic for patients with complicated psoriasis, clinic for patients with complicated skin cancer, clinic for patients with complicated vitiligo and pigmentary disorder, vitiligo being a loss of pigment on the skin. So that we have multiple subspecialty clinic in downtown area, but we have general dermatology clinic. We will have general dermatology clinic in Pearson. We have general dermatology clinic in other sites also in the suburb.
Two other things I want to just briefly go over before we close. What hours and days will dermatology services be offered here?
We are here on Monday to Friday, except on Wednesday. Wednesday, I think we have maybe 1 or 2 Wednesday a month, but the rest of the time we will be here.
Great, great. Yeah. And for viewers who may not necessarily know this, Dr. Lim, in addition to all the other things that he does and is a subspecialist and has special areas of interest in pigmentary disorders and in photodermatology or photomedicine.
Right.
Can you speak to us about that in about a minute and a half or so?
Yes, yeah, sure. Yes, the one area that we do quite a bit in terms of studies, clinical studies in terms of patient care is vitiligo, which is one of the pigmentary disorders that you had mentioned. Vitiligo essentially is a loss of pigment on the skin. Michael Jackson disease, I think that's probably the most well-known celebrity that had vitiligo. And it is a very devastating disease because there is a loss of pigment. It can involve the face or any other parts of the body, including the hands. So it is on the exposed side. People would see the condition right away. And because of that, not only it has is a disease, but it has a very tremendous psychological and social impact. And we have been able to do a lot of treatment for these patients, and compared to the time when I was in training, the treatment has evolved and has developed very nicely now. We have many other treatments that we can offer to patients, from cream and ointment to ultraviolet light treatment to surgery, and we are the largest site in the US that perform vitiligo surgery actually, and we offer courses once a year for other medical centers to send their representative to come to learn about the surgical technique from us.
That's quite a feather in your cap.
Yes, thank you.
Well, Dr. Lim, thank you so much. It's been a pleasure having you here. You're an outstanding guest and appreciate your time.
Thank you very much, David. Thank you.
And thank you to our viewers as well. As always, we appreciate the time you spend with us. Take good care of yourselves and those around you, and have a great day.